Yeah, and I can speak to that personally. I mean, I spent, I started in August of 2016, and I spent my first congresses, the first kind of couple years walking around having physicians tell me, oh, there are no option patients, I can treat everybody, we know what we're doing, right? There's no need here. And I can be a little obstinate, and so kept at it, and I'd been through kind of working in structural heart for years and seeing the early stages where, with TAVR devices, that came out and said, well, let's try this new therapy, and cardiac surgeons were like, those patients, those extreme risk patients don't exist, right? Or there are only a few of them, and ultimately, I think we saw that, when you don't have a treatment for therapy, those patients aren't visible. There are no market reports on them. They aren't often acknowledged. They're not referred. They are out there. They're humans out there, but they are not visible to, often the actual treating physicians, because they're not even getting there, because the referring physicians are saying, nothing can be done for you, or oftentimes, they're just left aside. So, but once you have a therapy, once you have a solution, suddenly you find many of them, and that's exactly what we've seen. I mean, the estimate of the number of no-option patients, it seems like every Congress I go to, the number goes up a bit, right? And Roberto's work with talking about small artery disease and some of the new publications coming out pointing to, 25% plus of patients who are non-responders, who are not healing, even though you can open something, right? The goal of opening an artery to get blood to the foot is, that's what we're all working on. But if by doing that, the blood doesn't get past the ankle and only goes to the ankle, well, obviously you're not going to heal the wound. So what's the efficacy of doing that? We need to get blood to the toes, to the forefoot, which is where the wounds are. So I think, again, when you have a therapy, slowly the clinical community starts to look at the evidence and realizes, hey, there are a bunch of these patients that are getting missed today. So I've been working hard to answer the question that Tim had, right? And it's been a journey, but now I think we don't hear that anymore.